Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Zenker's or pharyngoesophageal diverticula. So in Zenker's or pharyngoesophageal diverticula, here there is mucosal outpouching or pulsion diverticulum is seen mainly through a triangular area which is called as Killian's triangle. Where is this Killian's triangle? It is present between the horizontal fibers of cricopharyngeus muscle and the lower horizontal fibers of the between the horizontal fibers of cricopharyngeus below and oblique fibers of thyropharyngeus above. So if this is the esophagus posteriorly, okay, here there are two muscle fibers. Okay, one we have cricopharyngeus and second we have thyropharyngeus. Okay, so this is thyropharyngeus, whereas this is cricopharyngeus. So between the cricopharyngeus and thyropharyngeus there is a space which is called as Killian's dehiscence. So this space is called as Killian's dehiscence. Thus, so whenever there is outpouching of esophagus through this space of Killian's dehiscence, then we call it as Zenker's diverticulum. So why is this occurring? This is because there is increased intraluminal pressures occur. Why? Because of any reasons. It can be due to whenever there is abnormal esophageal motility, this abnormal esophageal motility will cause increased intraluminal pressures. When the pressures inside the lumen here increases, these will push the mucosa and submucosa, and as a result there will be outpouching will be seen like this. So here, because of this increased increased intraluminal pressures, these will push the mucosa and submucosa through the muscular defect in the vessel wall, and the muscular defect here is Zenker's diverticulum, and thus it results in pulsion diverticulum, where only the mucosa and submucosa will flow through the defect but not the all the cells. So for example, if this is the layers of esophagus, mucosa, submucosa, muscularis propria, then uh, there will be only outpouching of the mucosa and submucosa, whereas muscularis propria is normal in the uh, diverticulum. In the diverticulum, here there is only outpouching of mucosa and submucosa. This type of diverticulum is actually called as pseudo diverticula, where there is only outpouching of mucosa and submucosa through the defect. So this is a type of pseudo diverticula. So this Zenker's diverticulum mainly arises posteriorly in the midline of the neck, and the sac will project laterally. Though it arises posteriorly, the sac will project laterally, and especially it projects laterally, usually to the left laterally. So though the sac is arising posteriorly, the sac will project laterally, usually it projects to the left lateral side. Then this Zenker's diverticula is a pseudo diverticula. It is not a true diverticula. And then this is actually, though it is a pseudo diverticula, it is the most common esophageal diverticula is Zenker's diverticulum.
thank you and thank you for watching.